Alright, this is my audience. Hi, my name's Alyssa, and I'm going to talk to you guys today about Alzheimer's disease, about the causes, stages, and treatments. Dementia is very common among the elderly population, and Alzheimer's is the most common form of dementia. It's a progressive degeneration of the brain. By degenerative, it's a wasting of the brain, and by progressive, it's an irreversible disease. I'm going to be using an interview with someone we'll call Jamie to highlight the symptoms for you and the different stages because her mother had Alzheimer's disease. But before we go through the stages, you might want to know how this disease develops. The risks included for this disease are vascular diseases like high blood pressure, high cholesterol, stroke, heart disease, and diabetes. It's also more common in women and more common after the age of 65. Head injuries can also play a role in developing it, as well as genetics. If you have a family history of it, you're more likely to develop it later in life. There's not a specific cause for it, but it's linked to three things. One is amyloid plaques that build up in the brain, and it's basically bad tissue replacing the healthy brain tissue. Just like plaque's not good for your teeth, it's not good for your brain either. And you also get tangles inside your neurons, which are just more bad tissue replacing the healthy tissue. And it's also linked to loss of synapses, which our brain uses neurons to communicate throughout our body. So when you lose the synapses, you're losing the connections between the neurons, and it's like losing pieces of the puzzle. The onset of symptoms are insidious because you don't see them coming, and it's usually not diagnosed yet, although others might suspect something's wrong. It's not diagnosed because the symptoms are very vague. They're vague cognitive things like forgetfulness. During the early stages of Alzheimer's, it is usually diagnosed because there's an apparent cognitive decline, and there's also personality changes that occur. They might forget new names of people they were introduced to in recent events. They have trouble planning and organizing, like trying to write a budget, and they also have problems with time orientation. The changes in personality include social withdrawal and poor judgment, like leaving a stove on. And Jamie's mother would actually hide telephones and remotes in drawers and other obscure places and blame others for stealing them. During the middle stage of Alzheimer's, you have increased cognitive impairment, increased personality changes, and also physical decline starts. These patients will forget the names of people close to them, like spouses and children. They also forget a lot of their personal details and personal history, and they're very unaware of their surroundings. Personality-wise, they can experience delusions and paranoia, and this can cause them to become violent. For example, they might think their caregiver is an imposter or trying to harm them. They're also unable to perform their ADLs by themselves, which are activities of daily living. They will need assistance with bathing themselves, using the toilet, and dressing for the proper seasons, and they might even need help eating. Incontinence can become a problem. They might have some accidents, and they'll also experience a sleeping change. They might be awake all night and sleep during the day. Jamie's mother would wander occasionally, which they found her in Mill Creek Park in the middle of summer, wearing a winter coat and carrying a stack of picture frames. So that's actually a really big safety problem. During the late and end stages of Alzheimer's disease, there's almost no cognitive function. They can't hold a conversation. They can only really mumble and make noises, and they're very unaware of their surroundings. There's physical impairment. They can't control their movement anymore. They can't lift their head or turn, and they also lose their swallowing reflex, and their muscles can become very rigid, and they no longer can perform any ADLs. They'll need a lot of assistance dressing, eating, and cleaning up. In conclusion, this disease is very devastating, and unfortunately there aren't many treatments for it. There's drugs to slow the progression, and there also are palliative treatments which provide comfort care. To care for the complications and try to prevent complications in the late and end stages of dementia, you want to do ROM exercises, which is range of motion, so stretching their limbs out so they don't get contractures, which are freezing of the muscles. They can get muscles frozen like this. And you want to remind them to eat and swallow their food and also monitor their weight so they stay well nourished. You'll want to use pillows and rotate them every 2 hours so they don't get any bed sores, and keeping them well nourished and preventing bed sores and also keeping them away from sick people will help reduce their risk of infection. And this is really important because patients don't necessarily die from Alzheimer's, they usually die from the complications of the disease. Medications to slow the progression include acetylcholine sterase inhibitors, which allow acetylcholine to be produced more, and it helps improve their memory. This is usually given to them in the early and middle stages of Alzheimer's. It includes medications like Cognex, Aricept, and Exelon. And drugs do still need more work. In 2001, there was a study of donazepam, which patients on this increased their clinical rating of dementia, which they were more prone to maybe wanting to participate in group activities, but it didn't really help with their self-care deficits. So even though it's 2013, we still have a long way to go. And I hope none of you guys ever have to experience this or ever have to see a loved one go through this. But if you do, hopefully you're a little bit more informed about it, because the best way to prevent it is through early detection. So thanks for listening.